Welcome to the press briefing. On stage, we have Dr. Albert Au, Principal Medical and Health Officer from the Center for Health Protection, and also Dr. Lau Kai-hin, Chief Manager from Hospital Authority. Dr. Au will give us an update of the epidemic situation. Fellow citizens, friends from the media, good afternoon. I would like to report to you the situation and number of cases reported yesterday, the 21st of March. Cases tested positive was 94, 20 confirmed by HA19 by public health laboratory and 55 by private laboratories. Yesterday, we have 143 positive cases through RAT. Yesterday, we had a total of 237 cases reported. So in the fifth wave, we have got 1.19 million, 776 cases, 748,581 tested positive by PCR, 449,114 cases reported positive by RAT. Among yesterday's cases, 25 were imported. The remaining 215 were local cases. Among the imported cases, 13 were detected upon arrival at our specimen collection center at the airport. The remaining 10 cases were identified either at quarantine hotels or in isolation facilities. There's one on day 2, 3 on day 3, one on day 4, 4 on day 5, one on day 10 at an isolation facility. His fellow traveler was positive, and so the two went into isolation facility together. 8 cases reported from the U.S., 4 from Singapore, 3 from India, 2 from Canada, and 1 from Argentina, 1 from New Zealand, 1 from Germany, 1 from United Arab Emirates, 1 Mexico, and 1 from Bangladesh. Yesterday, there was a case tested positive on day 9 at a community testing center involving a 41-year-old man. He had 3 jabs of vaccines, asymptomatic. He arrived on the 11th of May from Australia. In March, he was confirmed in Australia. So he was in a quarantine hotel until the 18th of May. On day 12, his sample taken on day 9 was indefinitive, and then the sample was sent to public health lab and confirmed positive with a very high CT value. On the 20th and the 21st of May, samples were taken respectively, again negative. So we classified preliminarily this as a positive case. Another case was positive on day 14, sample taken at CTC involving a 46-year-old man with 3 jabs of vaccines. On the 22nd of May, that is on day 12, he had minor symptoms. He arrived from Singapore on the 9th of May. He had no previous record of infection. He was in a quarantine hotel until the 15th of May. On the 20th, i.e. day 12, his sample taken at CTC was positive with a CT value of 2324. We checked with a private laboratory, and we did a full genome analysis to classify the variant involved. He lives in Belt Air, Block 6. During his quarantine on the same floor or same flat, same room on another floor, had no cases. Because his CT value was rather low, it could be a local case. That is, he was infected after quarantine. It could also be an imported case. Right now, we cannot make a definite conclusion. We have to wait until results from a full genome sequencing is available to determine this variant. We've done some investigation. After completing quarantine in a hotel, he went to work. He was in office in between the 16th and 20th of May. He worked in Tower 2 of Exchange Square in a BROQ capital management company. On the 20th, in between 6 p.m. and 7:30, he was on the 49th of Exchange Tower. He had a drink there at an American club. And then in between the 7th and 9th p.m. on the 19th, he went to a club in a gym on CP3 in Bel Air. Because we can't say whether this is an imported case or not, and the CT value is relatively low. To play safe, we will require these places to undergo compulsory testing as a prudent measure. Yesterday, the Public Health Laboratory did genome analysis on 73 cases. 2 were confirmed to be negative to 452-hour, and the remaining case did not have enough viral load. We did not have any BA4 or BA.5 or BA.2.12.1 cases. We had no new cases reported from care homes. Starting from Friday, the third round of testing for residents of care homes under SWD covered 3,000 residents. 10 positive cases were identified, but these 10 samples had a very high CT value, so we believe they were positive cases. SWD, Social Welfare Department, will arrange for these residents to be retested in the coming few days. Today is a school holiday, so we do not have new cases reported from schools. Yesterday, there was no new death case. In the 5th wave, so far, Hong Kong has recorded 9,157 death cases. The death rate still stands at 0.765%. Now, for previous clusters, for Lan Kwai Fong Hotel, there were 2 cases when cases were tested positive on day 12. They were suspected to be related to a cluster of Lan Kwai Fong Hotel, and places they have been to are now under compulsory testing. For the 64-year-old female, on the 13th of May, from 10:54 to 11:25, she was at phase 3 of Tai Kwu Shing McDonald's. 3 members of her family were there at this McDonald's at the same time from 11:16 to 12:27. So there was about 10 minutes or so overlap. On the 18th of May, these 3 cases had onset, and they were tested positive by RAT the same day. They live in Hong Ging Fa Yuen, Block C, involving a 41-year-old male and 8 boys, 8 and 9 years old. The 2 boys have to go to school. They are required to do RAT every day. On the 16th and 17th, they were negative, and the 18th, they were both tested positive. They did not go to school. We've collected their nasal swab, and they are sent to our public health laboratory for testing, and all 3 swabs are positive. We will conduct full genome sequencing and analysis to see whether it is variants prevalent in Hong Kong now or BA.2.12.1. At this stage, we cannot confirm whether these 3 cases are related to the case of a 64-year-old male. We have to wait for results of the genome sequencing. To play safe, we will also require residents of Block C Hong Ging Fa Yuen to be compulsory tested. And then another 3 cases from Benchmark involving 1 staff member and 2 students. Most of the coaches and students have been subject to testing. Now, for this new case, we're talking about a 64-year-old man, and he tested positive on the 21st of May. He had no contact with students, but he works with 2 previous teaching staff, and then we have 2 students asymptomatic, tested negative. One on the 20th of May by RAT, another had symptoms on the 18th of May, also positive by RAT. For another student, on the 13th of May at 4 p.m., he attended TMHK, Meixian. And so for this cluster, there are 24 students and 2 teaching staff members, and their onset was in between the 13th and the 21st of May. For TMHK, Samgo, 2 more cases, one involving a student from Benchmark. In this cluster, and related to TMHK, there are 9 cases, 8 who are students of Benchmark. That's all from me.
Dr. Lau, about the HA, please. There are 512 confirmed patients in hospital, 37 are newly added today. For those in the isolation facilities, there are 90 in first-tier isolation wards, 20 in second-tier isolation ward, 44 in North Lantau ICC. There are 16 new confirmed patients. We don't have any new critical cases yesterday. There is 1 newly reported case in serious condition for those who are in hospitals. There are 9 in critical condition and 9 in stable condition. There are 3 critical patients who are in ICUs. There are no reported deceased cases yesterday. 56 patients have recovered and been discharged yesterday. 47 have been discharged, rather. 49,818 have recovered in the 5th wave, and 49,519 have been discharged. Since the beginning of the year, 62,198 have recovered, 61,899 have been discharged. Today, we have not picked up any positive cases upon admission screening. For staff members, 23,018 came down with COVID, and 22,887 have returned to their posts. And there is an announcement about the designated clinics. We have been monitoring the COVID situation and adjust the services. Given the demand for GOPC, the HA will progressively stop the designated clinics and resume the GOPCs. There are 8 designated clinics that have been closed. There are 8 more that will be stopped tomorrow on the 23rd of May. And these clinics will be thoroughly disinfected. And on Tuesday, on 24th, they will be resuming GOPC service. Now for David Trench GOPC, it will resume the nighttime service. The HA will maintain 7 designated clinics, and they will be there to cater for the COVID patients. We'll continue to monitor the development of the pandemic and adjust the services. In particular, having regard to the relaxation of social distancing curbs, and we will be adjusting our services accordingly. As to the detailed arrangements, we have already published them in our press release for the 8 designated clinics that have been closed. The list has also been made available to the media. I now throw the floor open for questions. Please wait for the mic and identify the organization you represent. Lady here, please. TVB doctors. Today there is a new case, 46 male with 3 shorts. This is an imported case. He's been to Bel Air Clubhouse for workout. Did he wear any mask when he was doing gym? Well, that's testing positive on day 12, we conducted some investigation to see where he's been after he left the quarantine hotel. This is a likely local case, or this is also likely to be an imported case. On May 20th, day 12, he developed some symptoms, and the CT value is a little bit low, so we checked where he's been. And during the incubation period, the symptoms started on the 20th. On the 19th, he turned up at the clubhouse for some workout. So we have to investigate whether he kept his mask on during the workout. I don't have the information with me now. Next, please. Lady, please. Now TV. The GOPC services are progressively resuming. Given the pandemic, how many designated clinics will be kept? And are you going to be switching back to the designated clinics going forward? Now, for the benchmark cluster, is it stabilizing, or do you not rule out the possibility that more cases will emerge? Let me take the question about benchmark first, and see whether Dr. Lau has got anything to add. The investigation is about to be completed with regard to benchmark. At the beginning, on May 13th, between 4-ish and 6, there were some people who went to Tamjai Samko in Sheungwan, and we found that most of these cases between May 11th and 15th, and they were attending classes at benchmark. And this course has about 30 students, and there are 13 staff members in benchmark who have issued the CTNs requiring those between May 11th and 15th, those who stayed in this venue, i.e. benchmark, to undergo testing. Almost all of them have undergone testing. As far as I know, there is one who is awaiting the result. All the results have been available, and there are 24 cases that have been picked up involving 22 students and 2 staff members, or rather 3 staff members. Most of the students between May 16th and 20th developed symptoms. The reason for this outbreak is probably a transmissible student turned up at school, and through human interaction or through airborne route, he passed on the virus to other fellow students. And that happened towards the end of the course. The earliest case was the case that developed symptoms on May the 13th. And after testing positive, the student stopped going to the school. When the course is finished, there are more students that are developing symptoms. And probably they caught the virus during class. There is such a large outbreak, and the students were telling us that during class they had to do some talking loud, and sometimes they have to pull down the face mask when they were doing the talking, and sometimes they had a sip of water without the mask. There was also a common room, and in the common room they may eat something, and they would take off their masks during these activities, and it is likely that that caused an outbreak. Second, about the pandemic. The pandemic is stable for now. For the past 7 days, the number hovers around 200. From May 1st to the 20th, the number has been hovering around 270. We haven't seen any rebound. Over the past couple of days, we've seen some slight decrease to below 250. I think we have to monitor the situation for longer to see whether this downward trend will persist. There is fluctuation on a daily basis in terms of the caseload, and we don't have to be too worried about the daily tally. The key thing is to look at the trend, And I think we have to pay particular attention to the admission number, the new figure, and the death number, and so on.
I'm sure we'll all remember that at the peak of this outbreak, many patients had to be home isolated, and then we started to operate designated clinics in the community so that for COVID patients in the community, they can seek medical consultation, receive drugs, and subsequently the oral drug for COVID. At its peak, we have 23 designated clinics at different parts of the community. As Dr. Au said, the epidemic situation has stabilized, and we've seen figures falling, and we are now at around 200 to 300 cases per day, and the demand for such services is also dropping. Now, as we all know, the designated clinics have been converted from general outpatient clinics, and therefore, for chronic patients and also patients suffering from episodic diseases such as flu or cold, they have demand for medical services. So we have evaluated the demand for general outpatient services. So we are gradually converting these designated clinics back to GOPCs. Now we have about 200 to 300 COVID patients living in the community. Most of them are not hospitalized. So in each cluster of the HA, we will have one designated clinic to facilitate COVID patients to seek medical help, to get drugs, and to be prescribed with the oral drug for COVID. As regards to future development, it depends on the development of the epidemic situation, and whether with relaxed social distancing measures, there will be more cases. We'll closely monitor the figures. Where need be, we can very quickly turn some of the GOPCs back to designated clinics. Having balanced the situation, we believe that the 7 designated clinics in operation will be sufficient. Next. I'm from AM 730. Regarding the McDonald's at Taikoo Sing or City Plaza, do you know how many patrons were around? And did you only find the link by checking the 3 students? Now for will any CTN be issued for Club Bay wing of Bel Air? And for Site 1 and also South Horizons, no case has been identified after the restriction testing operation. Why were they chosen? Is it because of a high viral load from their sewage surveillance program? I'd like to know the reasons for that. And for designated clinics, do you have information on the number of attendances, and that is the utilization rate in the recent few days? Now, in Taikoo Shing or City Plaza, there is a family of 3 members positive. Now, we had 2 cases tested positive on day 12 in the community. So a compulsory testing notice was issued. So if you've been to the 11 premises under the CTD, they should carry out a PCR. So far, no new case has been identified. But for newly reported cases, for each and every case, we will conduct investigation and understand the whereabouts of these patients, where have they been to, and then, depending on information we gather, we'll then decide whether these are 2BA.2.121 cases detected on day 12. So 3 cases were found. They had onset on the 18th of May. On the 13th, they were at phase 3 of City Plaza, McDonald's restaurant there. There was a short duration when the 2 when this group and the two cases were also there, but are they really linked, or is it just a pure coincidence that both groups were there? Now we have to conduct a genome analysis because there are many cases or transmission chains in the community. So we have to look at the results of genome sequencing before deciding whether they are linked. Well, the tables were very far apart. And when the First Lady left, it could be that she walked past the table where the three were seated. But we will have to look at the results of genome analysis before we can decide whether the cases are epidemiologically linked. But it takes time for results to be available. So buildings where they live are now under CTN. And regarding the case tested positive on day 12 who live in Bel Air, according to our investigation, the case did not eat in any restaurant. Usually, the case had takeaway at work. During his infectious period, he went to American Club in Central, and the second was a gym in a club in Bel Air. His office and also Club Bay wing of Bel Air and also American Club in Central were included in the CTN. People who were there when he was at these places will have to be subject to compulsory testing so that we can identify cases as soon as possible. We still cannot decide which subvariant his case was. We don't know the possibility that it can be a BA.4, BA.5, or BA.2.1, 2.1 subvariant. But again, we have to wait for results of a genome sequencing. That takes time. As for restriction and testing, the government uses different indicators to determine what buildings are high risk, and then we will carry out a CTN to identify silent transmission chains. And the indicators can be from results of a sewage surveillance program and whether there were cases identified in the past 7 days. That's how we identify suitable buildings for CTN. For instance, if positive samples are found in their sewage, because the epidemic situation has eased, the EPD and DST collect about 100 samples, sewage samples from different places of the territory, and the number of positive samples is steady at around 20 to 30 with a low viral load. If the viral load is high, we may carry out CTN, but that doesn't mean that we can always identify positive cases, because in Hong Kong we also exercise home isolation for patients. So when a patient is recovering or has recovered, it's possible that he can discharge virus. So CTN may not necessarily yield positive cases, but through these operations, if we have silent patients or silent transmission chains in a building, we want to detect them, identify them, and to prevent a further spread of the disease. We have already tested 123,000 odd attendances in our designated hospitals. In our designated clinics, most of them are booked by our patient care service hotline. So on the 12th, we reduced the number of designated clinics to 15. So on average, we have few scores to 100 patients seeking help at our designated clinics. So we have decided to retain designated clinics that are more accessible and popular among members of the public. They will continue to take care of our COVID patients in the community. If necessary, people can make bookings.
Lead at the back, please. Economic Times. the 46-year-old male, I'm not sure whether it's imported or local case, it's been to the clubhouse. Are there cases from this clubhouse, and how many close contacts? And this 64-year-old female who's been to McDonald's, was she there on her own? And there is a family of 3. Were they sitting by the door? Where was the 64-year-old seated? Were they far apart? And have you contact traced how many customers were there? The family of 3 on May 18th, they developed symptoms, and on May 13th, and they've been to McDonald's. So they were 5 days apart, and it's an incubation period a little bit longer than usual. Also, the Wong Chuk Hang Hong Kong Youth Graduate Association College, and in new cases, the benchmark, you heard from the students that the students probably took off the mask in class. We asked the benchmark students, we were told that they had to keep the mask on in class. Did you ascertain the situation? Was there any misleading information, any misrepresentation in their account, any super spreader there? Thanks very much for your question. Day 12, the one coming back from Singapore. He's living with a domestic helper, and that's a household close contact who will be sent to quarantine center. There are no other close contacts. He's eating on his own in the office, and he kept his mask on when he was working. We will follow up on this as a precaution. Those who stayed in this in these places during that time will have to be subject to CTN. But on these 2 locations, we haven't found any close contacts, and the investigation will go on. The second question is about the Taikushing cluster, the lady BA.2.12.1 case, the 64-year-old female. From her account, she was seated quite some distance away from this family of 3, and the family was seated close to the counter, but this lady was seated further away. We cannot be sure whether it was coincidence that this occurred, or whether this family also caught BA.2.12.1. But since they appeared in the same location, and we cannot rule out the possibility until any genome sequencing that they are linked. So as a precaution, we are doing the contact tracing. Now in this eatery, the 64-year-old female, on May the 13th, around about 11, she was listed as someone subject to CTN. We've collected all the Leave 'em Safe app information. We'll be following up on the lab results. As to incubation period, we are not certain whether the transmission took place at the McDonald's, so we cannot be certain for the time being. Probably they caught the virus elsewhere, or probably we are not sure whether these 2 cases are in any way related. So we cannot say that transmission took place on May the 13th. The information we've got is that for the 3 people, they developed symptoms on May 18th, and the students, they have to undergo RAT test on May 18th. They tested positive, and the mother also tested positive. The father tested negative so far. For the third question about the secondary school from yesterday, today is a school holiday. We don't have any new cases. For benchmark, we understand from the students that in class they were not supposed to eat or drink, and they had to keep the mask on, and most of the students will observe this protocol. Some said that in class they would put down the face mask for a sip of water, or when they were doing the talking, they would put down the face mask. And they said that there was no PA system in the classroom, and they would do the presentation. They would stay a little bit distance away from the rest of the students, but definitely in the common room, they would take off the mask for a sip of water. Gentleman here, please. Doctors, Ming Pao Daily. The Lan Kwai Fong Hotel cluster and the Mount Parker Lodge case, the mother, is she working from developing symptoms after McDonald? Where did he go? Where has she been? According to Professor Yuen Kwok Yung, there was some information available. Are there any people who have to be sent to quarantines from the hotel? And if so, how many? And what are the dates? Professor Yuen said that there is no conclusion how the transmission took place between the Nepalese persons and the American couple. And are there any close contacts arising from the American couple case? And also the Hong Kong Youth Graduate Association College for the 3 cases that were announced. What is seating plan like? Where were they seated? And also Mount Parker Lodge. The students, where did they go to school? Is that it? And benchmark. The CHP talked about this case. Is there only one single course during that period from benchmark? And for the teachers, did they teach other courses other than the one in question? Right, about the family, the 3 cases from Mount Parker Lodge, we try to work out their whereabouts during the incubation period. They had onset on May 18th, and they tested positive, and thereafter they stayed at home. They never left home, and nor did they go to school. We haven't found any close contacts so far, and during the incubation or during transmission period, they stayed at home, and they didn't patronize any particular eateries. For the 2 students, they attend Quarry Bay Primary School in 2 different classes. After they tested positive, they submitted their results to the school, and we were also notified, and that was announced a couple of days ago. The second question about the Lan Kwai Fong Hotel. Yesterday, we've arranged for all the staff members and also all the occupants in the hotel to undergo a PCR test. We haven't picked up any new cases. For those who are serving quarantine in this hotel, we did look at the orientation to identify the risks. After May 7th, on the 32nd and 33rd floor, Unit 04, and also from 10th to 30th floor, those staying in 0607, they are closer to the smoke door of the rear staircase. Probably, if there was some leakage from the piping through the negative pressure, the virus could have been transmitted. And After they left the hotel, they had to undergo the compulsory testing. We will look at the results. Most of them have already completed the day 12 testing. They tested negative, so they would not be listed as close contacts, and they don't have to be lengthened in their quarantine period.
As regards the source, as explained by Professor Yun, it's because of a chimney effect. In this hotel, the sewers are in a duct, and there is also a vent. The duct has got a door, but then there may be some leakage. A gas with viruses may have leaked out, and because of the chimney effect, the air got to the top, and because of a positive pressure effect, the gas might have got into the back staircase, and then when room doors are open, then the gas might get into rooms, affecting mainly residents in the higher floors. So whether the source was from the 22nd floor to 23rd floor is hard to say, because their genome sequencing is identical, and the dates of onset were very close as well. And of course, for the one who had an earlier onset, there's one from Nepal living in room 3304. Positive in a sample taken on day 4, but whether that is definitely the source patient is hard to say. For the 2 asymptomatic patients tested positive by RAT, we've arranged for nasal swabs to be taken to go through PCR to look at the CT value and also the genome sequencing. As said, the couple left the quarantine hotel and they went out together. They had no other close contacts and no other family members. As regards to school announced yesterday, because today is a school holiday, no new case has been reported. In previous investigation, it's found that the 3 classmates did not sit very near one another. They were seated at different corners of the classroom, and it's not that they are very close. They did not have any face-to-face contact. So we believe that we have this cluster. We can't rule out the possibility of a transmission within the classroom. The first had symptoms on the 16th. He was negative in the morning, but then positive by the afternoon. So it could be that he spread the virus when he was in school. The 3 students affected from this school all had 1 jab of vaccine. And for the remaining students, they either had 2 or 3 jabs. So it's possible that they are better protected, so they're not yet infected. Still, we have to wait for RAT results tomorrow and the day after. So far, no new case has been reported from the school. Tomorrow, students will have to do RAT before going to school, and we'll see whether we have more cases from this school. I have to make a correction. Yesterday, a journalist asked about the agenda of the 3 students. Now, it should be 2 male students and 1 female student. Regarding the question on benchmark, I am sorry, I have forgotten what it was. Speaker did not come through. That's our understanding. Next, the lady in red. I'm from cable TV. Now, for the case involving a family of 3, I'd like to know the number of vaccines received by the parent and the 2 boys. In other places, we have cases of monkeypox. And has a CHP assessed the risk of monkeypox being spread in Hong Kong? Do you have any expectation of an outbreak in Hong Kong? The family in City Plaza all has been vaccinated. The mother, 3 jabs, and the 2 boys, 2 each. So they are vaccinated. As regards monkeypox, we closely monitor the outbreaks in Europe. Last week, WHO announced relevant information. Our preliminary assessment is that the risk to Hong Kong is low. According to information we have, and according to announcement by WHO, the UK were the first to have an imported case, and then gradually they've had about 20 cases. No epidemiological link with the first case. And they haven't been to places affected by monkeypox, mainly in Western and Central Africa. So these cases were not epidemiologically linked. And WHO announced that there were over 80 cases around the world. Some are still under investigation, involving over 10 countries, but they are mainly in Europe. According to preliminary information from WHO, this round of outbreak mainly affected young males, involving male homosexual contacts. And so in the genitals, there may be some wounds, and then WHO suspects that it is a sexually transmitted issue. So we'll closely monitor the situation. In Hong Kong, we have port health measures. All arrivals at Hong Kong, if they display symptoms, they will be hospitalized and isolated. We've also notified the hospital authority and to remain close liaison with the HA. Our public health laboratory has the ability to make a diagnosis should there be a case here in Hong Kong. I have nothing more to add for the time being. Last question from that gentleman. I'm from Hong Kong 01. I've got a few questions. In around this month, CHP has resumed contact tracing. But then we are having 200 to 300 cases per day. I'd like to know whether contact tracing is really effective in lowering our number of cases to a double-digit figure. Is it really useful in containing the epidemic? And Dr. Sophia Chen said that there is no ruling out the possibility of a 6th wave of outbreak. Has CHP assessed under what circumstances will there be a 6th wave? And what will be the number of cases before you classify it as a 6th wave? Now, for those aged between 18 and 59, they can then get a 4th jab. Can you tell us the vaccination rate of a 4th jab in this age group, and also the kind of vaccines they have received? First, on contact tracing, I said in March, because of the sheer volume of cases reported every day, it was impossible for us to contact each and every case for contact tracing. So we had an online platform for the public to provide information to us covering their address and residential and work addresses. So we could only conduct some very basic analysis focusing on their residential and work addresses. As the number of cases continue to fall, we hope to conduct in-depth epidemiological investigation that is for contact tracing. The purpose is to identify possible places of outbreak. We now focus on high-risk places such as care homes. This has always been our concern. And the second is schools. If we have more than a couple of cases from a school, we'll take the initiative to find out any links among them. And as for other premises such as eateries, and learning centers, etc., will conduct contact tracing. Will ask for information of where they've been to, and by means of the Leave Home Safe app, we'll also try to find out places they've been to, so we can identify possible clusters and outbreaks. And then through compulsory testing notices, will require people who have been to these high-risk places where there have been outbreaks to conduct tests, so that if infected, they can be detected as early as possible. Through these, we hope that we can identify cases early, so we can take public health measures, including isolation, and send close contacts to quarantine to further intercept transmission chains in the society. So we hope that we can lower the number of cases in the community as far as possible, so that we can buy time before we have a rebound of the situation. We can keep the number of cases at a low level, and to allow members of the public sufficient time to be fully vaccinated to increase our herd immunity.
As regards the sixth wave, we don't have any specific number where we would consider the onslaught of the sixth wave. It all depends on the development of the pandemic. I think the key thing is in monitoring the pandemic, the key thing is not to look at the daily tally. Most people have been inoculated, and where they have symptoms, they would be mild, or some don't even have any symptoms. So we have to see whether there is any rebound, and also the daily hospital admission numbers, and the number of people who have to be sent to ICU, and the number of people who are deceased. And these numbers would give us some ideas about the state of the pandemic. As to when the sixth wave is going to arrive, it's a matter of time. Members of the public may have the immunity, and as time goes by, the immunity will wane, so we have to count on inoculation. In the days ahead, there will certainly be mutant variants, and there will be immunity escape that might happen, and this would increase the likelihood of infection or outbreaks. For the fourth shot, the scientific committee had a meeting yesterday for some discussion. It is the view of the scientific committee that for those between 18 and 59, looking at the scientific data and all the relevant literature, three shots, whether it be Sinovac or BioNTech, will be able to provide immunity for a couple of months. For those who are working in high-risk sectors, like working in elderly or care homes or healthcare settings, or if they have to go overseas for education or whatever, they have to balance the advantage, and they can go for the fourth shot. The CSB has published a press release. They can have the same-day ticket at the community vaccination center or the inoculation center after May the 26th. That they can make the appointment online. We don't have any numbers yet because this has just been rolled out for appointment to be made. For those between 18 and 59, for those who are eligible for the fourth shot earlier, they were the immunosuppressed or compromised people. That's it for this press conference. Thank you all very much.